Have you ever met someone who is extremely picky about their food? Perhaps they only eat a very limited range of foods, or they have a strong aversion to trying new things. Maybe they avoid entire food groups or have very specific rituals around eating. They might refuse to eat foods with certain textures, colors, or smells, or they might need their food prepared in a very particular way. While some may dismiss this as picky eating, it could be a sign of a more serious condition. Avoidant Restrictive Food Intake Disorder, or ARFID. Unlike typical picky eating, ARFID can lead to severe nutritional deficiencies and significant distress. ARFID is a relatively new diagnosis, but it is a serious eating disorder that can have a significant impact on an individual's physical and mental health. People with ARFID may experience weight loss, nutritional deficiencies, and even growth delays in children. The anxiety and stress around food can also lead to social isolation and depression. This essay aims to shed light on ARFID, exploring its definition, causes, symptoms, and treatment options. Understanding the root causes of ARFID, which can include sensory sensitivities, past traumatic experiences with food, or a fear of choking, is crucial for effective treatment. By understanding ARFID, we can better support those who live with this challenging disorder. Support can come in many forms, from professional help like therapy and nutritional counseling to the understanding and patience of friends and family. Together, we can create a more supportive environment for those struggling with ARFID, helping them to lead healthier and happier lives. ARFID is often mistaken for picky eating, but it goes beyond simple preferences. While picky eaters might refuse certain foods, they generally maintain a balanced diet. However, individuals with ARFID have a much more restrictive eating pattern that can severely impact their health and daily functioning. Individuals with ARFID experience significant distress and impairment in their lives due to their limited food intake. This distress can manifest in various ways, such as anxiety around mealtimes, difficulty eating in social settings, and an overwhelming fear of trying new foods. They may avoid foods based on texture, smell, color, or fear of negative consequences, like choking or vomiting. For example, a person with ARFID might only eat foods that are white or have a specific texture, avoiding anything that doesn't fit their strict criteria. And this avoidance can lead to nutritional deficiencies, weight loss, and social isolation. Nutritional deficiencies can result in a range of health issues, from weakened immune systems to developmental delays in children. Weight loss can become severe, leading to further medical complications. It's crucial to differentiate ARFID from other eating disorders like anorexia nervosa or bulimia nervosa. While these disorders also involve restrictive eating, they are primarily driven by concerns about body image and a desire to lose weight. Unlike these disorders, ARFID is not driven by body image concerns or a desire to lose weight. Instead, the avoidance of food in ARFID is more about the sensory experience or fear of adverse reactions. Instead, it stems from sensory sensitivities, fear-based avoidance, or a lack of interest in food. Sensory sensitivities can make certain textures or smells unbearable, while fear-based avoidance might be linked to past negative experiences with food. Additionally, some individuals with ARFID simply lack interest in eating, finding the act of consuming food unappealing or even distressing. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, or DSM-5-TR, officially recognizes ARFID as an eating disorder. According to the DSM-5-TR, ARFID is characterized by an eating disturbance manifested by a persistent failure to meet appropriate nutritional and/or energy needs. This disturbance is not better explained by lack of available food or by an associated culturally sanctioned practice. It is also not due to a concurrent medical condition or another mental disorder. If the eating disturbance occurs in the context of another condition, it is considered severe enough to warrant additional clinical attention. The exact causes of ARFID are not fully understood, but research suggests that a combination of factors may contribute to its development. Genetic predisposition, sensory processing issues, anxiety disorders, and negative experiences with food, such as choking or vomiting, are some of the potential risk factors. Early childhood experiences, such as traumatic feeding experiences or restrictive feeding practices, can also play a role in the development of ARFID. For example, a child who has had a negative experience with a particular food, such as choking or vomiting, may develop a fear or aversion to that food and other similar foods. Section 5. Beyond pickiness. Recognizing the symptoms of ARFID. Recognizing the symptoms of ARFID is crucial for early intervention and support. Some common signs and symptoms include dramatic weight loss or failure to gain weight appropriately, a limited range of preferred foods, for example, only eating a few specific foods, avoidance of food groups or textures, fear of choking or vomiting, and a lack of interest in food or eating. If you notice these symptoms in yourself or someone you know, it is essential to seek professional help from a qualified healthcare provider or mental health professional. Section 6. Emma's story. A glimpse into life with ARFID. Emma, a bright and engaging 12-year-old, had always been a picky eater. From a young age, her parents noticed that she had a very limited range of foods she was willing to eat. As a toddler, she refused to eat anything other than pureed fruits and vegetables. Her parents tried to introduce new foods, but Emma would turn her head away or cry. As she grew older, her food repertoire expanded slightly, but she still limited herself to a handful of foods, mostly plain carbohydrates like bread and crackers. She avoided foods with strong flavors, textures, or colors. Emma's parents tried everything to encourage her to try new foods, but she would become extremely anxious and distressed at the mere thought of eating something unfamiliar. They tried making mealtime fun, offering rewards, and even consulting with nutritionists. Her limited diet began to take a toll on her health. Emma often felt fatigued and lacked the energy to participate in activities she once enjoyed. She was severely underweight, her energy levels were low, and she frequently complained of stomach aches. Her growth was stunted, and she often felt isolated because she couldn't join her friends for meals. Concerned, Emma's parents took her to see a pediatrician who diagnosed her with ARFID. The diagnosis was a relief in some ways, as it gave a name to Emma's struggles, but it also marked the beginning of a long journey towards managing her condition. Emma began working with a therapist who specialized in ARFID. They used food exposure therapy to gradually introduce new foods in a non-threatening way. Over time, Emma made small but significant progress. She started to try new foods and even found a few that she liked. Her family supported her every step of the way, celebrating each small victory. With a more varied diet, Emma's health improved. She gained weight, her energy levels increased, and she was able to enjoy activities with her friends again. Emma's journey with ARFID is ongoing, but she and her family are hopeful for the future. Section 7. Navigating treatment, a path to recovery. Treating ARFID typically involves a multidisciplinary approach, including therapists, dietitians, and medical doctors. Therapy such as cognitive behavioral therapy or CBT can help individuals identify and challenge negative thoughts and behaviors related to food. Dietitians can provide nutritional counseling and develop meal plans that gradually introduce new foods and increase caloric intake. Family-based therapy can also be beneficial, especially for younger children with ARFID. This type of therapy involves educating and supporting parents in helping their child expand their diet and develop healthy eating habits. Section 8. Raising awareness, fostering understanding. ARFID is a complex disorder that can have a profound impact on an individual's physical and mental well-being. By raising awareness and fostering understanding, we can help reduce the stigma surrounding ARFID and encourage individuals to seek the help they need. It is important to remember that ARFID is not a choice. Individuals with this disorder are not simply being difficult or stubborn. They are struggling with a real and debilitating condition that requires compassion and support. Section 9. Your role in supporting individuals with ARFID. If you know someone with ARFID, there are ways you can support them on their journey to recovery. Be patient and understanding. Avoid pressuring them to eat or making negative comments about their food choices. Offer encouragement and positive reinforcement for their efforts to try new foods or expand their diet. Most importantly, encourage them to seek professional help. With the right treatment and support, individuals with ARFID can overcome their challenges and live full and healthy lives. Section 10. Conclusion, a call to action. ARFID is a serious eating disorder that can have long-term consequences if left untreated. By understanding the definition, causes, symptoms, and treatment options for ARFID, we can better support individuals and families affected by this condition. Let us work together to raise awareness, reduce stigma, and promote early intervention for ARFID. Together, we can make a difference in the lives of those struggling with this challenging disorder.